Great. Thanks, Jennifer. I appreciate you setting this up. My name is Mark Eisenberg. I'm the Executive Vice President of Healthcare Advocacy for Zotec Partners. First of all, I want to start off by thanking all of our clients and all of our physicians that are out there helping combat this pandemic. Very much appreciate all the hard work that you're doing, and I'm happy to make some information available to you that might be helpful during this time. Joining me on the call today, we have Ron Miller, who is our attorney, as well as our lobbyist from Barnes & Thornburg. Ron brings a wide variety of knowledge to Zotec and to our clients, and helps us navigate through Washington, D.C. in order to become advocates on behalf of all of our clients. In addition to that, prior to joining Barnes, he was a deputy commissioner and general counsel for the Indiana Department of Workforce Development. So we're going to get some of that expertise as well in this presentation. But he and Brian Callahan, who's a practice manager within Zotec Partners, are going to talk specifically about the SBA loans and the details and the tactical steps necessary to apply and hopefully receive those available funds. And then in addition to that, we have Ed Gaines, who's our VP of Regulatory Affairs and Industry Liaison. Ed is going to briefly touch on two other potential funding avenues. One is the public funds that were made available through the CARES Act of $100 billion for HHS to disseminate, and then the other is the Medicare accelerated payments, which have been getting a lot of attention as of late. I would like to thank everyone who's helped put together this presentation and the materials that we have been sending out to clients. It's amazing that Washington can go from entire gridlock to just free-flowing in a matter of days, but some things will never return to normal, I guess. But with that, I'd like to just do a little housekeeping. If you have questions during this and during the presentation, if you can send them to Jen, she will try to answer them if we have time at the end. If not, please just send it to the advocacy@zotecpartners.com email, and we will do our best to get you answers back as soon as possible. With that, I'd like to turn it over to my colleague, Ed. Ed, are you there?
Thank you. Yes, thank you, Mark. Welcome, everybody. I'd like to join Mark in his comments and great appreciation to all of our clinicians who are out there defending us against this global pandemic. I think Mark had probably the quote of the month the other day when we were asked a question about one of the government programs, and he said, you know, I'll have to check into that because this is my first global pandemic. So it was a point of humor, which is good in light of where we are. So I appreciated that comment and totally relate to it. So the Public Health and Social Services Fund was created by the CARES Act, which was signed by the President last Friday. It's a $100 billion fund. We don't know specifics about how it will be distributed, but it is applicable to any hospital or clinician who's enrolled in Medicare and or Medicaid. So physicians are fully eligible for this money. The American Hospital Association has asked HHS for an amount that approximates to about $25,000 a bed for hospitals, kind of large, $30,000 per bed for hospitals that are in what are called hot spots. So we are supporting, Zotec is supporting our specialty societies who have written letters into HHS. We're very much at the table in this process. We just don't have a lot of specifics right now. What we are hearing from HHS is they're going to prioritize the hot spots. We all know many of those: New York, California, Detroit, Chicago, those areas, and then be looking to other areas. One of our recommendations is for the clinicians to try to capture, if you're a medical director, assistant medical director, how much time is specifically being devoted to COVID, and that time, capture that in some, even in an informal way with a spreadsheet or something of that nature. This fund is to pay for things related, attributable to COVID that are not expensed or picked up in other programs. So this is kind of the fund of last resort. So think of it that way. hopefully there'll be more coming out on this very soon. The next program has actually been around for many, you may remember this program, for decades. And this is an advanced payment program. CMS announces these in public health crises and hurricanes, natural disasters. So this program is like that, but unique in some ways. A clinician can ask for 3 months of advanced payments. We know the measurement period will be October 1, 2019 to the end of December, so fourth quarter of 2019. So it will be 3 months of your net reimbursements, Medicare Part B, not Medicare Advantage. And then you don't have to pay anything back. So if you got your check yesterday, April 1, you would not have to start to pay that money back through recoupments by the MAC until August 1. Then there's a 3-month recoupment period. So it's not one that is favorable, we think, in terms of either a grant or other type of program. Plus, there's a concern that if volumes are not recovered, say by August, September timeframe, you could end up with a debt to the MAC because the current claims in those months of recovery, those 3 months of recovery, won't be sufficient to recoup the advancement that you got based on fourth quarter volumes. So there is an X factor there, a risk factor as it relates to the advanced payment program. So we can take questions at the end on these. There are also some reimbursement aspects of the CARES Act that we can get into briefly, or certainly ask us offline. So with that, I'll hand off to my colleague, Brian.
Thank you, Ed. Good afternoon, everyone. I'm excited to share with you what we believe is the most effective program created to date that Congress has enacted to help small businesses. Again, thank you for joining us. These are uncertain economic times, and we're more than aware that you have some very difficult decisions that lie ahead of you. And it's our intentions, it's our goal most of all that you find the time that you've invested with us here today helps you, it helps your business to navigate through this critical time. Congress has enacted 3 pieces of federal legislation since March 6th to address the coronavirus pandemic. And they're being referred to on television and media as COVID-19 1.0, 2.0, and 3.0. And those pieces of legislation have generated thousands of pages of law, interpretation, well-intended guidance from the agencies that oversee these programs. And I was on a call yesterday, I heard somebody refer to it as, it feels like we're drinking from a water hose. And that's exactly what's happened over the past month. With each piece of legislation that's been enacted, several programs have been created that were all intended to help small businesses. Under the 1.0 legislation, it began with Congress funding the Small Business Administration Disaster Loan Program. That turned out to be kind of an underwhelming amount of money. I think it started under $50 million. With the 2.0 legislation came programs designed to assist small businesses and to help them provide paid leave to employees who are impacted by COVID-19. Schools are shut down, kids are at home, folks need to be there to take care of those infected and those children that are subject to school closures. So these programs were are the Emergency Paid Sick Leave Act and the Emergency Family and Medical Leave Expansion Act. And those programs also offered instantaneous tax credits to employers to fund these leave programs. Congress also introduced the concept of taking Social Security credits, employee retention credits, and each of these programs, while helpful, they do have their limitations. But last Friday, when Congress enacted the $2 trillion stimulus package, which I believe is the largest financial rescue package in U.S. history, there was a program created in that legislation that provides some real impactful relief for small and medium-sized businesses. The CARES Act earmarked $350 billion in funds for the SBA that was allocated to help small businesses keep their workers employed. The vehicle or the mechanism that the SBA is using to administer and distribute those funds is something called the Payroll Loan Protection Program. And a lot of people have heard that recently. And based on everything that we know to this point, if we were to rank each of the programs that are out there under the three pieces of legislation, hands down, we believe it's the PPP program that's going to provide the most impactful relief with what should be quick access to cash. And most importantly, if you are to use the funds for its intended purposes laid out in the program, which we'll describe in later slides, that debt can be forgiven. So while we've all heard the term, there's no such thing as a free lunch, this is a free lunch. It's not an extravagant lunch, but it's a program that we feel deserves focus and one that can help you. So there's $350 billion in the pot. And to put that in perspective, the entire SBA department underwrote just $28 billion in loans during 2019. So the SBA was overwhelmed. It didn't have the resources to administer the program, so they turned to banks and credit unions and other lenders that were already SBA certified lenders, and they leaned on them. So rather than dealing with what became the broken systems of the SBA, if anyone tried to log on to the SBA, you noticed that the sites were crashing. The telephone systems were overwhelmed. They went from what I read was 200 calls a day to over 3,000 calls a day. And that was just under the disaster program. So loan applications will now be processed through local lenders. And in most cases, your banker, your local bank, is probably an SBA certified lender. You'll want to contact them and you want to make sure that they are part of the SBA program. So the nice thing that this approach really does for all of us is it gives us an opportunity to work with folks that are local. The power has been delegated to, or the authority has been delegated to these local institutions. They make the loans and they approve the loans. It just has the SBA backing to it. So it's a streamlined process that really is going to benefit all of us. Go to the next slide. Yeah, so who's eligible for these loan programs? Employers with fewer than 500 employees. There's some exceptions for folks that are in that have franchises in the food industry. Makes sense, they want to get relief out to those industries. Sole proprietors, independent contractors, self-employed individuals, they're all eligible to participate in the plan or in the program. There's one caveat that you must be operational as of February 15th, 2020. Next slide. So one question that's come up is how affiliations might affect eligibility for these PPP loans. And typically, you have to include affiliates when you apply the size test to determine your eligibility, that you're under 500 employees. And what they're really trying to get back to is, are you really a small business? The CARES Act waived some of these affiliation certificate requirements, but there's certain things they did not waive. And one thing they want to make sure of is that you do, based upon our view of the application that's out there right now. It was in sample form last night, but what's out there says you're not affiliated with someone that's been suspended or disbarred from participating in a federal program. You're not presently involved in a bankruptcy. You're not presently delinquent on an existing SBA loan. And there's a specific question that I read this morning in the loan application. It says, is the business or any owner an owner of any other business or have common management with any other business? If yes, attach a listing of all affiliates and describe the relationship as Addendum A. And when I spoke to a banker about that, or a lender about that earlier this morning, the answer to that was, look, be transparent. Communicate what relationships, what affiliations you have. They're not using this to disqualify folks from participating in the plan. What they're really looking for is the potential for folks to be double dipping in the plan. Next slide. So how much can be borrowed in the PPP loan program? The amount is limited to the lesser of $10 million or 2 times your average monthly payroll cost from the prior year. And so what that says is that there's an exclusion. You have to exclude a prorated portion of any annual compensation over $100,000 for any person. So in this case, if you're someone that makes $400,000 a year, you're not able to divide that by 12 and come back to a monthly payroll cost of $33,000. It caps you at $100,000, and so the limitation is $8,333.33 times the 2.5 multiplier. So while this will not make you whole, you have to remember this is free money. And so it's an opportunity to make up some of the difference here. The terms of the loan, the repayment terms are 2 years and 0.5% interest. And things continually change. As of 2 days ago, that was a 10-year term and 4% interest. So we're desperately trying to keep up with everything that's happening. There's certain waivers. Unlike other SBA loans, you don't have to show that you can go and get credit elsewhere. There's no collateral that's required. There's no personal guarantees that are required on the loans either. Next slide. So how can PPP loans, loan proceeds be used? The loan proceeds, if they are used for the following items, are eligible for forgiveness. So payroll costs. Again, the calculation to come back to what you're eligible for caps it at $100,000 per person, and the amount that is forgiven is capped at $100,000 per person. So if you have folks that make under $100,000, that is where there may be a difference when you talk about 2.5 times what you're allowed. The expenses apply for an 8-week period after the origination date of the loan. So there's a reconciliation that occurs that says, look, once you take the loan, you have 8 weeks in which to spend the proceeds and do a calculation as to where those funds were spent. So if there are additional funds remaining, you're allowed to include group health insurance. You're allowed to include interest on debt or rent and utilities. Again, you're allowed to borrow these funds between or go back to February 15th, I believe, and all the way through is it July 30th. So that's the reconciliation period that you're dealing with. Next slide.
Hey, Brian, this is Ed. I think it's June 30.
Yeah.
June 30, 2020.
June 30.
Okay.
Okay.
Yep.
Perfect. So the next slide, what's the catch? The payroll protection program is meant to ensure that businesses have funds to pay their employees and prevent layoffs and prevent furloughs. The loans are going to be forgiven if you use them for those intended purposes that we described earlier. I have one out of order here, but the amount forgiven will be reduced proportionally to the amount of work reduced. So what they're essentially trying to get at here is you cannot take the money and then lay off all your employees. That's what they're trying to prevent in saying that there's a look back period to ensure that you did not reduce your work staff after you received the funds. So the principal will effectively become a grant and will be forgiven. Any accrued interest on the loan will need to be paid back, but that can be deferred for 6 months and even up to a year. And the forgiveness amounts will not be included as part of your taxable income. Slide. So when does the application process begin? It starts tomorrow. For small businesses and sole proprietorships, they can begin to apply now. So if you're an independent contractor, self-employed individual, that process starts next week. According to what I've read, according to Treasury Secretary Mnuchin, they're expecting and wanting a 48-hour turnaround on the funding. How realistic is that? I guess it depends on the banker you're speaking with and what their expectations are, how fast they can get through the loan application itself. But what I would encourage everyone on the call is don't delay. Start this process today. There's a number of items that need to be gathered. Next slide. So there's a number of items that need to be gathered, and you can start that. You can start doing that right now. These are items that are kind of common across lenders. We've seen variations, wanting more information, wanting less information. I was on a call this morning, and one banker was looking for copies of driver's license. That's the first time we've heard of that, but these are the common items: business tax returns, your latest business tax return, year-end financial statements through 2019, payroll reports to support the payroll numbers that you're multiplying by 2.5% to get at the maximum loan amount, payroll tax returns that kind of verify those figures, breakdowns of any benefits that you're allowed to apply to those folks that make under the $100,000, like group health insurance, retirement costs, a 12-month profit and loss statement as of the date of the application. Those are all things you can gather now. The payment, the PPP application, we provided a link for you here. As of yesterday, I haven't checked it this morning, as of yesterday, it was still in kind of a sample draft status, but it is a streamlined application. It's only a 2-page application with 2 pages being, with 2 additional pages of instructions, and most of those are just disclaimers. So I would encourage, I guess I just want to close by saying that I would highly encourage you to take advantage of this program. Reach out to your bankers, start gathering these documents. This is an opportunity to gain access to free money, and I wouldn't let it slip through. I wouldn't let it pass me by. I hope that was helpful for everyone on the call. And Ron, I guess you're up.
Okay, thanks, Brian. And so to the extent that folks have gotten to a point of needing to furlough or lay off employees or finding themselves unemployed along the way, hopefully this part of the presentation will help address some of those issues and give you some ideas about what's going on with the CARES Act and unemployment. Go ahead and move me up one there, Ed. So many employers are familiar with the basics for traditional unemployment.
because anytime they separate an employee or, go through some activity like that, they have some interactions with the state workforce agency. And so the CARES Act actually works through three main buckets of unemployment benefits. And so I'm going to go through and talk a little bit about these, and then also just kind of some basic unemployment type information. The first bucket that gets created by the CARES Act is what's called pandemic unemployment assistance. Now, the federal government in the Department of Labor statutes already has a category of unemployment that is federal-based called disaster unemployment assistance, or DUA. This pandemic unemployment insurance really tracks along with that in a lot of respects, and we see this invoked a lot when you have natural disasters like tornadoes or hurricanes or earthquakes. And what it does is it has the effect of helping people who might not otherwise be qualified for unemployment for a whole variety of reasons find some eligibility in that program, and basically it tries to be an economic stabilization tool to use in places where there is some sort of disaster. What's happened with this pandemic is the disaster is actually nationwide. And so in some respects, this is very unprecedented. And I was involved with workforce development. I was the chief administrative law judge and deputy commissioner for that agency. And my tenure there covered the recession of 2008 and 2009. This is a much larger scale than even that was from initial appearances. We'll talk a little bit more about what actually is in pandemic unemployment assistance and why it's so different, but essentially it does have the effect of extending benefits for folks who would not otherwise be eligible. And there's a fairly big category that I'll kind of run through here in a moment. The second bucket is what I would call traditional unemployment. And essentially what this is are folks who would normally be qualified if they got furloughed or laid off, meaning folks who have sufficient wages in the test period, which varies a little bit from state to state, but generally is going to be now, since we're in April, is going to be 2019. So as long as folks have sufficient wages there and their job circumstances are such that they are considered unemployed by the state criteria, then they'll be eligible for traditional unemployment assistance. The difference here is the federal government is adding a $600 supplement. That is a flat rate. It is not income tested. It is, if you qualify for state unemployment, the $600 stacks on top of that. And so there is kind of an unusual thing here with the traditional unemployment bucket, where folks can actually draw more money per week on unemployment than they might draw during their normal payroll and going to work every day. And the federal government is aware of that anomaly. That was a fact that was very heavily debated in the Senate before the CARES Act passed. And there were senators kind of on both sides of the aisle, but lined up in support or in opposition to the flat rate provision for the $600, because it does create that anomaly, and I'll kind of talk about that a little bit more too. But the final bucket is what's called emergency extended unemployment assistance. And this essentially is sort of the last backstop for people who are exhausting their benefits. And so anybody who has, for example, who's already been on unemployment and now finds themselves still on unemployment but rapidly running out of benefits, this will be their backstop to try to carry them through sort of this crisis time and hopefully, carry them on until things get back to normal. It is up to 13 weeks and just tacks on to the end of what would be a normal state unemployment run. And I would mention, just as a little bit of background, the unemployment system is a federal-state partnership. So the U.S. Department of Labor, USDOL, really sets kind of broad parameters and broad guidelines for how the program is to be implemented. This comes out of the Social Security Act of 1935, so it's been around a long, long time. But then each state has a lot of leeway to implement unemployment in fashion, the fashion that it wants to do it. So what you see is that weekly benefit amounts are different state to state. The income replacement is different from state to state. The wage credit test to see if you qualify monetarily vary from state to state. And even the number of weeks. Indiana, for example, is 26 weeks. There are some states that only cover 12 weeks or 13 weeks of unemployment. So in those states, folks might exhaust much sooner, and this emergency extended benefit level will kick in for them in that kind of a circumstance. Go ahead and move me up, Ed. Oh, there we go. So the pandemic assistance defines this covered individual as somebody who is otherwise not eligible for regular unemployment under state criteria. And so the calculation that goes into this is they leave it up to the state to evaluate the claim and to come up with a weekly benefit amount, and then they add the $600 on top of it. For the pandemic unemployment assistance, this is totally federally funded. So it doesn't impact experience accounts. It doesn't impact the state trust funds. It is entirely paid by the federal government for both the calculated portion that you would get under state law and the $600 federal supplement. So it also relaxes the traditional test for individuals. You know, the normal, you have to be able, available, and actively seeking work. There is recognition that folks who fall under this category may not be in a position to do that. And so those standards are being relaxed. And again, the implementation will vary from state to state. And on this next slide here, we'll kind of go through some of the categories of what covered individuals are. This could be people who've been diagnosed with COVID-19. It could be people who have a member of their household who's been diagnosed, people who have been told to self-quarantine by a medical professional, people who have symptoms and are awaiting a test or diagnosis. And it can also be people who have child care issues if they are the primary caregiver for the child. And just as kind of a side note, this is one area that's causing a lot of gray area concern for employers all across the country, because normally child care issues are something that are essentially is the employee's responsibility. So, you know, if I have a young school-age child and my daycare closes or whatever, it's my responsibility to find new arrangements and to make arrangements for that. In this circumstance, nationwide, schools are closed, daycares are closed. You just don't have a lot of other options. And so it is possible that people may be placed in a situation where they're not able to come to work because they have these child care issues. Now, I mentioned here that also folks who are self-employed or don't have a sufficient work history, those are some other categories that kind of tracks along with the disaster unemployment. Now, as I said, this varies from state to state. And so the test of, the sort of the veracity test, if you will, of whether someone really has a medical diagnosis or whether they really have child care issue is going to be left up to the state workforce agencies. And so it's possible that, particularly if you're familiar with operations in multiple states, somebody in Indiana might have to provide a doctor's note, for example, or a letter showing that their daycare is closed, while somebody in another state may not have to do that to be able to qualify for unemployment under these categories. It also means that it is not necessarily a slam dunk, so to speak. So I've talked to some employers who say, well, I have some employees who say that they'd rather just stay home or that they have child care issues or whatever. Are they going to qualify for unemployment? Well, the answer to that is I don't know. That employee will have to file with their state workforce agency and see how their claim's handled and whether there is additional documentation required or what needs to be done. I do know from guidance from the Indiana Department of Workforce Development that they are expecting, if you claim COVID-19 diagnosis, I think they're expecting you to be able to provide some sort of physician's letter or documentation, whatever, that substantiates that. And with respect to folks who just are nervous about coming to work, or, who believe that they fall into a vulnerable category and, don't want to go out, all those kinds of things. Those things typically would not be considered to be a covered individual for purposes of this level of unemployment, at least according to the Indiana Department of Workforce Development. Some states might take that. So just as an FYI, it's hard to predict. And much like the SBA, like Brian mentioned, so just to give you some context, in Indiana, for example, initial weekly claims for unemployment in 2019 during this time period ran about 3,000 per week. This past week, 120,000. And the week before that was about half of that, so about 60, I think right at about 60,000 initial claims. So these state workforce agencies and the U.S. Department of Labor are just absolutely swamped with new initial filings and these additional categories and a relaxation of the traditional rules. So I can almost guarantee, no matter how hard they try, no matter what their intentions are, there will be mistakes made. There will be people who get benefits that shouldn't, people who get denied that shouldn't have been denied. Those kinds of things will happen. And so to some extent, everybody, unfortunately, will have to be a little bit patient with that. And particularly with respect to people who should have qualified or that they believe should qualify, they may have to go through a little protest procedure to try to get it back in front of somebody. Anyway, so that's the pandemic piece. And again, this is kind of a much broader category than you would normally find in an unemployment situation. Back during the recession in 2008, 2009, the feds did not add a flat rate amount of money on top of benefits. They tended to add weeks, so that at one point in time, it literally was possible to draw unemployment for like 104 weeks, depending on what your circumstances were and what industries you'd been in. This is very much different, and just because it's adding that money in, and I think that is part of the stimulus effort to just try to get money in people's hands so that they have it to spend and they have it to, sort of weather the crisis. Ed, if you can move me up another slide there. So with respect to traditional unemployment, again, this able, available, and actively seeking work criteria is somewhat relaxed. Basically unemployment in the state of Indiana just doubled last week, and I think it's doubled in most states, to be honest, in the span of about a week or two. There's just some recognition that folks are not going to be able to do an active work search, and frankly, everybody wants folks to stay job attached anyway. They want them to go back to their jobs in 2 weeks, 3 weeks, a month, whenever we get through this crisis. So there isn't a heavy emphasis on doing that. You do have to make some certifications to the fact that you would otherwise have been able and available, but for your impacts by COVID or your employers closing and all that. Again, traditional unemployment, state weekly benefit amount plus the $600 supplement. The $600 supplement has a termination date of July 31st, 2020. I truly believe that there's some possibility that could get extended, simply because I'm not so sure that this is all going to be cleanly resolved and everybody back to work in time. But at the moment, it's July 31st. The federal government is also paying for a waiting week, and many states, about 20 of them.
Now.
I'm sorry.
Okay, but anyway, you should definitely be applying for Brad's help. Okay.
So a lot of states have a waiting week. About 24 of them, I think, do, which means that you don't actually get your benefits on the first week. You file your claim, you have the waiting week, and then you jump into it. The federal government offered to pay 100% of benefits on the waiting week. And so states like Indiana waived that by executive order. I think Ohio did that as well. Michigan did. There are a number of others. So that waiting week if you're accustomed to that with unemployment issues with your staff, that waiting week has gone away, and it is the state weekly benefit amount plus $600, and it's paid entirely by the feds. And as I mentioned before, this does have the unusual circumstance that some employees may actually make more on unemployment than they do in their regular job, which in many ways provides a big disincentive to people wanting to come to work. And so those are issues that, at least from my standpoint, I believe the employer has to retain control of how the workforce operates. And so if you need people in the office, you need people there, or, your facility or whatever. If you don't need them, then you don't need them. But it's your decision to make, and not the employee's decision to note that their neighbor or their friend or their spouse is at home, making $100 more than they normally earn. So those are just kind of some practical aspects of this, and that's why there was very vocal debate about that $600 provision. If you can move me forward here. The emergency, the final tranche, that 13 weeks, fully federally paid, includes that $600 bump. But the one thing that I will say is that by the time you get to this level, there is written into the CARES Act, they don't relax the able, available, and actively seeking work so much. So this is somewhat recognition of the fact that you've already been on unemployment for quite a while, and you need to really be making your best efforts to get back into the workforce. And so this level has not enhanced, but not relaxed able, available, and actively seeking work requirements. Again, depending on how the economy does and what comes up in potential future legislation for stimulus package or recovery packages, this 13 weeks could also get extended, or there could actually be another level added that might just be, a flat amount. It could be income dependent. There could be a lot of different ways to calculate. If you move me ahead here, Ed. So just a few kind of additional points as I kind of wind down on all this. Guidance from the United States Department of Labor and from individual state workforce agencies has been a little lacking so far. As Ed mentioned at the very top of all this, CARES Act was signed into law last Friday. This is, we're even a week into this. And, in terms of everybody getting ramped up for this, state agencies having to modify their IT infrastructure, their portals, kind of work through all those things, train staff, and get everything ready to roll. It's not surprising. My hope is that as we get on towards the end of this week, the end of the day tomorrow, or even the beginning of next week, there'll be some more updated guidance that will help flesh some of these things out a little bit better. Many states are going to look to mutualize the expenses to their UI trust funds that come about through the COVID-19. What that will do, and I know for a fact Indiana and Michigan are both going to do that. I've seen a few others that are. And I think there's a general push to do that nationwide. But the issue there is, if you've had to furlough employees, normally that would go against your employer experience account and would cause your rates to go up for payroll taxes in future years. If they mutualize it, because there's still a significant and substantial sectors of the economy that are in operation and not not in those kinds of layoff or furlough statuses, those expenses will get mutualized around. Now, I'll tell you quite honestly, I think all employers in probably every state are going to see some sort of a surcharge to try to help recoup some money and build up the UI trust funds again, because this is going to be a real big deal. So that is something to expect, but it isn't going to be directly on an individual employer the way it would normally be during normal times. Here's a point I'm not sure anybody on the call is a reimbursable employer. i.e. a nonprofit or something along those lines. But if they are, there is a provision in the CARES Act, which I read to be some federal coverage of the reimbursable expenses. So reimbursables generally pay dollar for all their unemployment claims. I think the feds are going to cover that by about 50%. But some guidance that I've seen on some workforce agency websites don't seem to indicate that's fact. So I'm kind of waiting because ultimately they're the ones that will make the decision, not me. So I do want to make sure that we're clear on that point, that there's a provision in the CARES Act that appears to do that. So with respect to either traditional or pandemic unemployment assistance, the question always comes up, when does someone qualify? So if an employee is receiving compensation during their time off, they may not be unemployed for purposes of drawing unemployment compensation. The test really, again, varies a little bit from state to state, but in most states there is a category called partially unemployed, where somebody is making less than their weekly benefit amount would be. And to some extent, that would be like maybe 1 day or 2 days a week in a normal 5-day work week. Usually 20 to 40% get you under the threshold, but not always. That's something, we have to look at the state calculations and everything else. But if you fall under your weekly benefit amount, you typically are able to file and essentially get the balance of your weekly benefit in terms of a payment from state. And right now, if you qualify for that, then you qualify for the $600 federal stimulus bump. So it's possible even somebody who is working, for example, 1 day a week, getting paid 1 day a week when they normally work 5, would qualify for some level of state UI benefits plus the $600. So if you have some limited operations, that is also an option where, potentially somebody coming in and having to do some paperwork or billing or whatever, 1 day a week may still qualify for unemployment. And the only way to really test that is to have them, for them to go ahead and file and see what the state workforce agency comes up with. With respect to if they're totally on leave and you're totally shut down, but you want to give them something, payroll, and there's some good reasons to do that. I mean, sometimes benefits have to be deducted. There's some other things along those lines. If you take a look at it and try to keep them down below that weekly benefit amount on what you are reimbursing them, then they may be better off because they'll qualify for that the $600, at least through July. So there are some states that have what's called short-time compensation plans or work-share plans, and those are plans where if you cut someone, say, 20%, and you have an approved plan with the state, then the state UI will pay 20% of their benefit amount to help give them some income replacement during that time. The idea there is that you're not actually just laying them off. You're trying to keep them employed and fully engaged, on some level, or mostly fully engaged, I guess. There are generally some restrictions that go with the short-term compensation plans. And, again, those somewhat vary state by state, but it usually means that you can't cut them more than about, 45% or 50%. There are some other restrictions about whether you can or can't lay them off eventually. Everybody in the unit has to be subject to the same slowdown or reduction percentages. Just a lot of things like that. So, but interesting to know there are 26 states that have that. Indiana does not. Michigan does. I'm trying to think of a few others that I've looked at here recently. So, that is also an area that is worth checking into if you anticipate still needing to keep some operations going, but that you have to reduce them down in some fashion. If you could move me forward one more here. I think. Yep. And so that is it for me. So, Mark, maybe back to you.
Sure. We appreciate everyone who put together the presentation and the research that went into all of it. If there are additional questions, we're happy to answer them. Just email advocacy@zotechpartners.com and we will respond back to that in short order. We hope that this was helpful and give you some guidance in this time of uncertainty. Additionally, we will be making all of the publications available both at zotechpac.com as well as zotechpartners.com. Those should be up by the end of the day tomorrow. If you need them immediately, I would ask you to reach out to your client service manager, and we can make sure that we can get them to you as quickly as possible. So with that, I very much appreciate you attending. I know everyone's busy, so it looks like we'll be able to give you 10 minutes back. Feel free to, again, ask any questions. If you need to, reach out to your client service manager and would like to arrange a time to chat with us or to get additional documentation, we're happy to help as well. So hope everyone has a good remainder of the day and stays healthy and safe. Thank you all.